Erica Kegel is presenting at 7 p.m. and she's going to be presenting on the inside the veterinarian world. All right.
For my capstone project, I wanted to learn more about the veterinary world and more about what it's like to be a career. So I chose to study medicine because my entire life I've been interested in medicine. My parents are doctors, my parents are doctors. My sister is going to be a doctor. It's just all just part of my life. And I was going kind of like the people medicine and all that, and like I'm very interested in surgery, and I just thought that people medicine is a little bit too stressful almost for me, and there's a lot more pressure, but a lot of that pressure is released in veterinary medicine. There's a lot less pressure. It's not more like textbook, and I also just had a better connection with it anyways because I'm with horses my entire life. I shadowed at the Guilford Medical Center. It's associated with the Derm Vet, and it's located in Guilford, Connecticut. And there I met Paula, who's the practice manager and a veterinary technician. She was my mentor for this project. I worked with Dr. Janicki, who's one of the main veterinarians there, and then Cole, Elise, and Lauren, who were veterinary technicians, which are nurses, people. So there, I helped the front desk when checking in clients, and I went into appointments on their schedule and their routine where they were checking all the blood tests, and I asked questions about I want to learn more, so I asked them certain questions about certain like what they're doing, and I did any simple chores they needed done. For instance, I would restock the breeds and the heartworm medicine. I would clean the appointment rooms, and I would clean surgical tools after they're used. And of course, I would give the animals lots of love. The common surgeries there, they do just for patients, they do dentals, do root canals, cleanings. So for I wanted to focus on surgeries, and so for their pre-op steps, of course, they would make the initial appointment and they would schedule the surgery, figure out they needed the surgery, and then the day of the surgery, they would bring them in. They would take blood work if they needed to rule out any pre-existing issues. Then they would go on with so that was more relaxed and less stressed. Would then do an injectable induction of anesthesia, and they would and intubation is you want the end of the tube to the size of the animal's nostril. And the pre-op surgery steps are they would also lie the animal on the operating table. They would set up the heart monitor and ventilator. They would get the patient anesthesia log, which you can see on the right. And this paper includes the patient ID, the body weight, any medications that were given, and on the chart where all those symbols are, that indicates the heart rate, blood pressure, and the respiratory. And then their post-op steps, they would disconnect the animal from machinery. They would place the animal in a basket lid with a heated blanket to keep them warm. And then once the animal begins to cough, which means they're breathing over the intubation tube, you would gently pull out the intubation tube. Then you would place them in their crate, and then once all their meds wore, their anesthesia wore off, their owners would come and pick them up. So I also wanted to focus on very specific specialties. So I focus on neuro and derm, and a chronological problem cats is congenital vestibular disease, and that develops when the vestibular system, which is within the brain and in the middle and the inner ear, begins to shut down. Causes of it are inner ear infections, tumors, or exposure to certain toxins, and the symptoms are impaired balance, posture, and they may become permanently deaf. Next is muscular dystrophy. Causes are inherited defect in the production of an essential muscle protein, and the symptoms is muscle stiffness, muscle enlargement, difficulty swallowing, and general weakness. And as some cats get older, they may not be able to lift its ankles from the ground because they're so weak. And next is hypokalemic myopathy cats. These causes are low levels of potassium in the bloodstream, and it's an inherited disorder. These symptoms are episodes of weakness in the neck muscles, and cats cannot lift their heads, and it occurs. And the treatment is it's treated by potassium to the diet. The next one is feline encephalopathy, FSE. The causes are abdominal protein in the brain tissue prion. The symptoms are incoordination, abnormal gait, head tremors, muscle contractions, and behavioral changes. And the picture you see, it's an MRI of a cat, and where it's the, which is the abnormal protein. Next is common neurological problems in dogs. They can get Wobbler's disease or Wobbler syndrome, causes compression of the spinal cord and the spinal nerves. It's common in large. These symptoms are that they develop uncoordinated gait in their rear limb and to their front limbs as well as their neck. And they have neck pain, loss of muscle mass in legs and shoulders. The treatment is managing pain, inflammatory non-steroidal drugs or enzymes. The next is degenerative myelopathy or DM, the degenerative of white matter in the spinal cord, and these symptoms are hind limb weakness and paralysis. The last one is canine Parkinson's disease, and the causes are hereditary loss of neurotransmitter and or dopamine in nerve cells. And the symptoms are tremors, stiff muscle, difficulty of balance and walking. And then I have a video of the neuro exam that they perform.
Lucy, we have here Lucy, who is neurological on the hind legs.
10 years old.
And she's 10-year-old boxer, and she's here for an exam. And what I'm going to do is I'm going to walk through a neurological exam as the vet would do in practice. So the first thing we want to do, you can tell that she's weak on her hind legs. I want to observe. As she came out of her kennel, she was having trouble placing her. It looks like weakness, but at the same time, it looks like she's wobbling. So that's different than musculoskeletal. When she's wobbling like that, it's almost like she doesn't know where the leg is. So that's a clue that. So let's start with her front legs, if you want to hear. So the first thing we do is some knuckling. We try to place knuckles on the ground, and she should fix it immediately. And you can see she's barely even letting, so her front legs have good knuckling reflex. It's a postural reflex that they don't like to be on their knuckles, so they like to fix it right away. You can see that on her front legs, everything's working properly. Now let's try knuckling on her back legs. So here's her right. I do support her belly a little bit, so and I knuckle, leaving it in. And oh, there. So it took a while, right? So that means it's taking a long time for the signal to get up to her brain, tell her that she has a postural deficit in the back, and then come back down and replace the paw. So let's do this side. Same sort of delay. It's not immediate. She knows it's happening, but look, on that one, she's just leaving it. And she tried to fix it, and she didn't even know she hasn't fixed it yet. Okay? She still hasn't fixed it. So it's worse on the left. Sometimes you'll see that, where it's worse on one side than the other. So what this is telling me is that she likely has a lesion somewhere in her thoracic lumbar area that's affecting her hind legs. It's not far up enough to affect her limbs, and that's causing some of these postural deficits. Another one that we do is hopping. So I lift her other leg, and I drag her leg. Now see how that should hop properly? And so she's hopping properly, that's good. I'll do it the other way. She is hopping good, so that's good. She knows that she needs to do that. Now the last thing we're gonna do is, so if you want to get on the other side. Good girl, oh, good girl. Good girls. Over here, switch. I'm gonna check her reflexes on her hind legs. We got the reflex down here. First, it's reduced. So what we should see as a kick is a little bit more exaggerated than that. We're seeing a reduced kick. Barely a reflex there. Okay, well, it's more of a normal one, but the majority of them, are not reacting properly. Okay, we can do the gastric reflex, which is here. That one's pretty normal. Okay, but when I do the patellar reflex, reduced. You see that there's one more called the tibialis, and it plugs the hop right here. Pretty normal. So reduced patellar reflex, but other ones are normal. Very reduced. Okay, so we go ahead and flip. Patellar reflex on this side. Wow, there's nothing there. And this is also the side that we know was worse. So this is telling me her lesion is right at the lumbar region that innervates this left side. Okay, with maybe a little bit of the right side affected, but look, no reflex at all. Okay, let's do the tibialis. Reduced on the tibialis. Gastrocnemius. I would argue that's reduced compared to the other side. Okay, so I think we know where our lesion is between L1 and L7.
All right. So that was just showing the typical neurological exam. It shows the cord and how it connects throughout the back, and then how it separates off and connects through the different legs. And it shows that if something isn't working, it's not getting the transmitter to the brain, then it's an easy test to see. And the other specialty I wanted to focus on, dermatology. And so a common dermatological problem in cats is general dermatitis. The causes is that it's hereditary breed, can also be caused by parasites and ticks and fleas. The symptoms are color changes of their skin, oil accumulation, abnormal odor, or hair loss. In more extreme cases, you can see bumps, boils, scabs, or blisters. The treatments are cool baths, medicated shampoos, soothing topical treatments, and antihistamines such as Benadryl. And then on the right, there's just more symptoms such as thick skin or brownish saliva and constantly shaking their head. Common dermatological problems in dogs is alopecia. The causes are bacteria, common skin parasites such as fleas, ticks, mice, and lice. Symptoms are hair loss. Treatment is with flea control if it's caused by a parasite or certain medications. Next is seborrhea. The causes are sebaceous glands of the skin produce excess amount of sebum. These symptoms are scaly, flaky, itchy, and red skin. And the treatment can be feeding them omega-3 fatty acid supplements, anti shampoos, corticosteroid or retinol oral medication. And then the last one is main. The causes is passed from dog to dog or from like wild dog or like a wolf to a dog. These symptoms are severe itching, skin lesions, thickening of skin, hair loss, lethargy, and infection. And the treatment is antiparasiticin. Those are my nurses. Stop it. Okay.
Nice job, Erica.
Thank you.
So, a couple questions. So, given the experiences that you've had in shadowing and being able to see it firsthand, does it change anything for you in terms of considering going into the field as a career area? Is there anything that scared you away? Anything that was like, yes, this is it for me?
I kind of through it, I didn't know anything about the specialty that I wanted to go to because there's so many. And then through there, I just learned more about dermatology and neurology. And like it's more of a kind of a practice that I internet, and I kind of decided that I like that more than like a high stress hospital kind of emergency room environment.
Yeah, I can understand that, and I think that makes sense, and I think that's what's nice about the experiences is you can kind of figure it out from seeing it firsthand and all the different elements and levels. I think when we think about veterinarian science, we think just being a vet, but there's so many different aspects behind that that you had the chance to see. So what are next steps for you regarding this? Do you think you'll keep researching this area of interest? Do you think you might consider studying in college?
Yeah, definitely. I think continue shadowing at the vet over the summer. And I've kind of decided that when I go to college, I want to go into a biochem program and do all that. And then beyond that, like I don't really know about vet school. I know Cornell has a really good program, but that's like who knows where I'll be within the next 4 years. It might change completely.
Yeah, and you certainly don't need to decide right now, but I think it was a great starting point for you, and it sounds like you made some pretty cool connections. I'm going to open it up to the comments and chat feature on Zoom. So for those of you who are tuning in, if you just click on the chat on the bottom of your Zoom screen, you can make comments or ask questions. So I'm going to take a minute to see who we have here. So Mr. Maseni said, I may have missed it in your presentation, but how many years of school do you need for a degree in this field?
So you need 4 years to get your doctor of veterinary medicine, and then it's 1 year of fellowship per specialty. So if I didn't want to do a specialty and I just wanted to do basic appointments and basic surgeries, like how I explained, then it would just be the 4 years.
Okay, got it. So a little shorter than a medical doctor then. Mrs. Fitting said, well done.
Thank you.
And Judy Wallace, great job, Erica. You can use this on our mission trips. We see so many cats and dogs. That's a good point. Do you have animals yourself?
Yeah, I have 4 cats and a horse.
Oh, wow. Okay, so you really do. Do you find that some veterinarians are willing to take courses and others aren't, depending on their specialties?
There's a whole different like field for equine medicine. So there's like animal medicine. When you're studying your DVM, you do go through equine medicine. But I'm pretty sure if you want to be an equine vet, you have to do many more years because that's just like large animals kind of thing. So that's more like cattle and like sheep and that entire different aspect of it.
Makes sense. Well, really nice job tonight. I hope you keep up with this. It sounds like you learned a lot and you made some really good connections.